Hi, my name is Trinh. I'm a hygienist and co-owner of Small and Style for over 30 years, and I love to give information to patients more about dentistry. The implant crown is the most important part of the implant is because the implant is actually just the replacement of the root, but the implant crown is what the patient sees and actually uses and functions every day. So it restores function, aesthetics, and really confidence. So the implant crown is the most critical part in really restoring the patient's smile. Implant crowns differ from traditional crowns and bridges is that it works independently. It doesn't rely on adjacent or neighboring teeth, and it's actually attached to a titanium post, so it's longer lasting and more stable. What's going to make an implant crown feel and act like a natural tooth really comes to precision, shading, shape, and function. So we get it to a point where it's almost indistinguishable between a natural tooth, the adjacent tooth, and we're not just replacing the missing tooth, we're replacing a natural smile. So it's really incredible to make sure that it's done precisely so that it's almost like a natural tooth. With proper care, implant crowns typically last anywhere from 10 to 20 years plus. All depends on the type of material you use, obviously how it's placed, and how it's cared for during and after the implant is placed. What surprises patients the most when they actually receive the permanent implant crown is how normal it feels. Like it's an actual tooth they can brush, floss, smile, eat with confidence that it's going to stay in place and act like a natural tooth. A small and style, when we design an implant crown, we consider lip structure, skin tone, facial features, adjacent teeth. It's a whole patient's smile that we're restoring, not just a singular tooth or multiple teeth that we're replacing. So when we consider that, that is a seamless process that we ensure that when we're replacing that, we're designing that from start to finish. Patients should expect during an implant crown placement is that it should be fairly quick, but very precise. When we're checking the bite, the fit, and the shading, it should be completely indistinguishable with the adjacent teeth. So when we do that, it's fairly quick, but we want to make sure that that is still a very precise appointment. So typically that takes less than 30 minutes, and the patient's often going and functioning like a regular tooth the same day. It's important to pick a provider that is experienced in implant crowns because a crown really is about aesthetic, function, and confidence. So if you're picking a provider that is experienced in all three of those aspects, then you know that this is going to be a long-term treatment that you don't have to worry about 10, 5 years down the road. We had so many really success stories when it comes to implant crowns at Small and Style, but one that comes to mind is a patient again who's had a lot of dental work done that was failing, and he really wanted something that was more long-term, permanent solution, and really restoring his smile. I mean, even though he was in his 50s, and typically most guys are not really confirmed with aesthetics. I mean, concerned with aesthetics, but this guy, he really wanted that look. And once we restored his implant crowns, he had a fresher look, a new haircut. He lost a little bit of weight. He was just a new guy. I mean, we weren't just restoring his teeth or his missing teeth. We were restoring his confidence and like giving him a whole new outlook in life. And it really makes me smile thinking about that case as well. And we still see him regularly. And even though he has implant crowns, he still comes in regularly to maintain it to ensure that those implant crowns last as long as they can. So if you're thinking about getting implants to replace a missing tooth or missing teeth, the first thing I would suggest is to get a consultation. A lot of times you want to ensure that you are a good candidate for an implant crown restoration, and also your timeline. It does require a commitment. Usually the implant, when it's placed into and actually gets restored, it's a 4 to 6 month commitment. So we want to ensure that we're meeting the patient's expectations when it comes to restoring a missing tooth or missing teeth with implants. So I would say start with that consultation, ask all the questions that would align with what we're looking for an implant candidate, and then I would start from there.